Okay. Alyssa?
Yes.
My name is Grace. I'm going to be your student nurse today.
Hello.
Hello. Can you verify your last name and date of birth for me?
Dietrich 3/3/1933.
Okay, perfect. And I'm just going to be doing a quick head-to-toe assessment on you today. I'm going to be asking you some questions that might sound silly, but I'm asking all my patients these questions. And it should only take about, hopefully, 10 to 15 minutes.
Okay.
Yeah. So right away when I walk in, I notice that she's in a good mood. She has nice posture. I don't notice any lines, tubes, or drains, and she is alert and awake and to me. And are you in any pain today?
Nope.
And if you had to rate that pain on a scale of 1 to 10, 1 being no pain, 10 being the worst pain, how would you rate that pain?
0.
Perfect. Okay, I'm just gonna go ahead and start by looking through your hair, if that's okay.
Mm-hmm.
Okay, I'm not noticing any lumps, bruises, or any bleeding or protrusions that shouldn't be there. No balding or sparse areas, and her hair appears to be clean. She appears to be in good hygiene overall. Very nice. And okay, I'm just gonna go ahead and take a look at your eyes. Her eyebrows and her eyelashes are intact, and I don't see any sparse areas. Can you take your 2 fingers and pull down on your eyelids? Her conjunctiva is pink and moist, and I don't see any drainage. Very nice. And her eyeballs are round, and her sclera is white, which is good. Can you go ahead and look at my nose real quick? Okay, and her pupils are equal, round, and reactive to light. Can you go ahead and look at my nose and then look at the wall behind me? And her pupils accommodate to distance, which is all good things. I'm gonna go ahead and take a look in your ears. She's got lots of piercings. They all appear to be well kept up with. They're not red, swollen, or they don't have any drainage. Her ears are an appropriate size and shape, and they're even on both sides. All good things. I'm gonna take a look in your nose, if that's okay.
Sure.
I don't notice any redness, drainage, or swelling. It appears to be pink and moist. And can you go ahead and plug one nostril and breathe in, and plug the other nostril and breathe in? Okay, she has some nice clear patency. And can I go ahead and look in your mouth? Okay, her oral mucosa is pink and moist, and I don't see any lesions or drainage that shouldn't be there. And can you go ahead and tell me who I am?
You are Grace, my nurse.
Yeah, that's true. Can you tell me where you are?
I'm in the skills lab.
And can you tell me what year it is?
2025.
Okay, perfect. Her speech appears to be clear. I can understand her well. She responds to me appropriately, so I know that she is hearing me well. And can you go ahead and read what's on my badge?
BSN Student School of Nursing.
Okay, perfect. And her vision appears to be intact. Can you go ahead and pull on my fingers and push me away? And can you go ahead and flex up against my hands and press down like gas pedals? Perfect. Her strength is intact in all 4 extremities. And can you go ahead and close your eyes and tell me where I'm touching you?
Right leg, left arm, right arm, left leg.
Okay, and her sensorium is intact in all 4 extremities. I'm going to go ahead and check your neck now for check your arteries and stuff and make sure everything's good. Can you look right at me, and can you look that way? And can you look the other way? I don't notice any jugular vein distension. Her carotid arteries are nice and flat, and I'm going to go ahead and listen for any bruise. So just breathe normal. Okay, I don't hear any bruise, and I'm just going to go ahead and palpate one at a time. Where is your, sorry. Okay, there we go. You're about a +2 on both sides, and I'm just going to go ahead and check your radial pulses. And I'm also counting her breaths per minute while I'm doing this. Okay, you have an even pulse rate on both sides with a strength of about +2, and your pulse rate is about a 76 beats per minute. And your pulse strength on your brachial arteries are about a +2 strength, and her pedal pulses are about a +2 strength as well. Can you go ahead and put your hands out like this? I'm going to check your capillary refills. Okay, and your toes. And her capillary refill is about +2 seconds. Okay, I'm gonna go ahead and listen to your lungs now. Have you had a cough at all in the past couple days or weeks? Okay, perfect. Her chest is an even contour. She's not barrel chested or concave chested. She doesn't appear to have any labored breathing. And I'm gonna need you to take a deep breath every time you feel my stethoscope. And lift up your right arm for me. Okay, and then I'm going to go ahead and check your chest wall expansion on your back. Let all of your air out, and now take a deep breath, and let it out. Okay, perfect. She has even chest wall expansion on her back, and if I could have you swing your legs around to that side so I can listen to your back. And again, take a deep breath. Okay. And I hear clear breath sounds all around. I don't notice any wheezing or stridor. Okay, I'm going to have you lay down for me. And is it okay if I lift up your shirt and check your abdomen? Sure. Okay. She has a flat contour with no masses that I'm noticing. She does have a piercing on her belly button, but it is not red or swollen. There's no drainage. And I'm just going to go ahead and first ask you, when was your last bowel movement?
Yesterday.
Okay, perfect. Any abnormalities, changes with that?
Nope.
Perfect. And when did you last void?
This morning.
Perfect. Any abnormalities or changes with that
No.
you've noticed? Okay. And I'm going to go ahead and listen to your tummy. Just breathe normally again. Okay, she has bowel sounds present in all 4 quadrants, and now I'm just going to feel your belly a little bit, if that's okay, and
Sure.
you just tell me if anything hurts.
Okay.
Any pain?
Nope.
Okay, perfect. You can go ahead and sit up for me. And could you lift your arms up like this and put them down, and extend both your legs and put it back down. Okay, she has good range of motion, and I've checked her neck during her checking for jugular vein distension, and I've been assessing her skin throughout this entire thing, and her skin and all of her extremities and her face, neck, back appears to be pink, warm, and dry. And last thing I'm going to have you do is just walk toe to heel to that wall and walk normally back to me. Okay, perfect. She doesn't appear to be in any pain or discomfort. She doesn't appear to be weak on one side or the other, and she's well coordinated. So thank you so much, Alyssa.
Thank you.
Here's your call light, and call us if you need anything.
Okay, thank you.